In this article published in 2021, it goes through what is happening specifically in the musculoskeletal system after you have had COVID. And let me tell you, it's inflammation, and it's inflammation in a bad way. Up here, it shows COVID-19 induced inflammation has been found to negatively affect the musculoskeletal system through multiple processes, such as SARS-CoV-2 utilizes the ACE2, a receptor present on many tissue types, including smooth muscle, synovial tissue, and cartilage, to enter cells and undergo viral replication. The ACE2 receptor has many functions, including anti-inflammatory properties and restriction of bone reabsorption. Now, those people that had COVID and were hospitalized, they are saying that people that were on the ventilator have a greater shot of having pro-inflammatory signals that can lead to muscle and bone fragility measured by decreased bone mineral density. Get real nerdy in the science. Here we go. Studies have described how SARS-CoV-2 infection induces systemic elevations of cytokines and signaling molecules such as... This is a big deal. This is pain and inflammation in chemistry. That's what it goes on to say, that COVID-19 could be a cause of inflammatory reactive arthritis, which looks initially like rheumatoid arthritis. Now, anecdotally, I can tell you in my clinic, I've seen this a lot. People looking like they're having an RA flare or Sjogren's or lupus, and it doesn't feel right, and it's widespread joint pain. So this goes on to state that one case reported described 5 patients presenting with polyarthritis following COVID-19 infections with a negative RA factor. Okay, so this is all new. This is emerging. So if you have had widespread joint pain and you're having pain in more than one joint and you haven't done anything to increase it, this is worth having a conversation with your primary care doc about. Now, we do know, according to research, if you have had COVID, steroids are the creme de la creme gold standard. And in orthopedics, steroids are also the gold standard of treating inflammation. So we know steroids work, but you can't have steroids all the time because it will eventually weaken your tissues. But steroids are the gold standard for treating an acute flare in orthopedics, period. Like, it works. So we also know it works for COVID. So it does make sense that steroids are going to be helpful for you with that widespread joint. So it says, corticosteroids may be given for COVID-19 patients for acute inflammation, but these medications can lead to muscle atrophy, muscle weakness, and decreased bone density. Yeah, we can't have steroid packs. And a systematic review found that there was a prevalence of 19% of patients with COVID having myalgia. So guys, joint pain and muscle pain is real post-COVID. Talk to someone if you have it, okay?